guys, welcome back to Medical Coding with Blue. Today's episode is all about how to become a better medical coder. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this message and I'm not going to respond directly to this message because it's sort of a general question and I think this video is going to sufficiently cover what they're asking. So they said, "Hello, Miss Blue. I hope this message finds you well. I came across your video on YouTube. I'm working with a physician clinic and I have a question. What do you think is the best way to ensure maximized reimbursement on the outpatient side? What can we do, both from a clinician aspect as well as a coder/CDI aspect? I look forward to hearing from you." All right, so here's the thing. First of all, coders never look at reimbursement. What we do is code based on the documentation, based on the information that we have there. And if something needs to be queried because there's no clarification, there's no certainty about what is actually happening, then that's when we do a query, and that's when we get more information. But other than that, we are looking at what we have and we are seeing what codes we're able to select from this document. Now, when it comes to the CDI aspect of it, that's actually digging in deeper. CDIs are typically people who have a clinical background because they can spot the holes. They can look at the documentation and know there's something missing because they have that advanced clinical background. It doesn't mean that coders can't do this, because lots of people who have lots of experience that are coders switch over to CDI because they have that clinical background, or they have that experience where they know, hey, there's something here that's missing. It can be more specific, or there's going to be another code that can be selected. So with that said, the best way to get good with that part in the CDI part is to really understand the pathophysiology of the conditions that are being seen in that clinic. That's number one. You have to make sure that you as a coder, you as a CDI, really understand all of the conditions that are being seen in that clinic, meaning that you understand forward and backward what the diagnosis is and what it all entails, what are the symptoms, what are the treatments that are involved, and that kind of thing. You need to know that information. You need to know what kind of surgeries do they perform. You need to understand the process of those surgeries, and you need to be able to get yourself to watch videos so that you can see those in action, so that way it can make more sense to you. The more you do these types of actions, the better off that you'll be, because your understanding will be a lot more clear. It's not just, okay, here's the rules and we're doing the coding and this is what we do. No, it is a lot more to it than that. You have to understand what these certain words mean. Degenerative can sometimes confuse coders because sometimes they don't understand what degenerative means. So if you don't understand what that means, you need to look it up. And that's going to be something that a CDI has to know right off the bat. And a really good coder is going to know right off the bat. They're going to know the difference, and they're going to understand what all of that means and what it all entails when something like that happens, okay? Anything having to do with the body, you have to know the difference between the body's response or something external happening and it's an injury, right? We need to understand those things. And it doesn't matter what clinic you're in, because injuries apply to every single setting, okay? Every single one. So just something to keep in mind. But that's where we start. We start by making ourselves better coders. And how do we do that? We start understanding the conditions. We start understanding the treatments. We start understanding what are the treatment options that are out there. And it helps us because when we are reading the documentation and we see, okay, this person is on long-term this or that or whatever, then we understand that there's other codes that we can select. Because what happens, why do providers lose money? Providers lose money because their documentation is lacking. Providers also lose money because the coder didn't pick up the appropriate codes. Providers lose money because they didn't select, coders did not select the appropriate modifiers. Providers lose money when they don't listen to their coders or to the CDI, and they're like, oh, they want to do this and these are the codes that they want. And sometimes I've heard that, oh, they said that they don't want the coders changing any of the codes because those codes have always been selected. They've always been paid. There's no problem with that. That is not correct. You have to make sure that if the documentation does not support those codes, you have to change the codes, period. Otherwise, you will get a claim that is denied. And so that's how providers start losing money. So what does that tell you? That this is a two-way relationship. This is a team. Your responsibility is to be so proficient with coding that you're going to be able to recognize, okay, well, we need some more clarification here, and we need to look at these procedures that they're performing and make sure that they're actually doing these types of procedures. So the best thing that you can do is start off by having a conversation with your provider. That's a big problem for a lot of coders because they get so scared and they don't want to talk to the providers and they're scary and they get mad. No, y'all are a team. And when you start coming in with that energy of, I'm here to be your teammate, and you may hear them bluster and go on and say, oh no, I've always done it this way and how dare you question me? No one is questioning you. Okay, first of all, no one is questioning you. What we're trying to do is to get to the heart of what's going on here. Okay, does your documentation have everything it needs? Is everything being covered in this? Your documentation should include this, this, and this, XYZ, XYZ, depending on the specialty, all right? And then you need to look at those denied claims. Look at those denied claims and try to nail down why are these claims being denied? What is making them have to come back and, was it because a modifier is missing? Was it because the documentation was unclear? Was it, whatever the case may be? Nail down those reasons and talk about it with your provider. You have to show up and you have to be present with them and you have to walk them and guide them through, because again, this coding side is your wheelhouse. Your provider side wheelhouse is taking care of the patients and making sure the documentation looks good. But they are not going to know anything about the coding. They're not going to understand anything about the documentation unless you speak up. Because otherwise, guess what happens? If you are not talking to them about their documentation and about, okay, these claims were denied because XYZ, if you are not doing it, they're going to talk about it with somebody else. They're going to talk about it with somebody else, and they're going to do whatever they say. Let me give y'all a little story. So, my providers know better than this. And I want to show y'all how they know better. So, the first time when I had orthopedics and podiatry all to myself, because there was some years that I had a partner. But when I finally got orthopedics and podiatry all to myself, one of my providers, two of my providers went to a conference, and they were so excited when they came back. And this is how much of a relationship I had built with them, that they were so excited when they got back, and they said, Bleu, guess what? We got all this information from the conference, and this is how we're going to start doing it now. And I said, can I see this documentation, please? And so they showed me their slide decks, and I said, oh, no. And I showed them in the guidelines where this is the way that we do things here, and this is the reason that we do these things. Everything that those slides were telling them to do was not what we do at our facility. So, and that was like, can you imagine if they had just went in and just started changing things and did whatever they wanted to, and then all of a sudden I'm coding their stuff and it's changed? No. So they know to come and ask me. And then a few months later, another group of them went to conference, and sure enough, they came back to me and they go, Bleu, we know better. We're not gonna, we're not gonna listen because, they had all these other things, these weird things that they were saying. I said, you see, because you don't want to change how you're documenting if everything is running smoothly. Everything is running smoothly based on how I've been training them. So they need to know to trust you. They have to know that what you're saying to them is the truth, and they will know that you're doing your job correctly when you are, when they're getting their claims paid and they're being paid well, okay? Because it is possible for them to select their own codes, and then when you go in and then you can see something else different. It's possible that you're elevating their E&M level. It's possible that you're downgrading their E&M level. It really all depends on their documentation. Now, when I have to change the level on an E&M level and it goes up, I'm like, okay, this is really good. And so later on, I'll tell them about, okay, I was able to move you up on an E&M level because of this, this, and this. There was more things going on. And they go, well, I didn't even know that. I didn't know we could get credit for that. But you documented. And that's the great thing. Even though they don't understand if they're going to get that information, if it counts for anything. They know that their job is to make sure that everything that happened with that patient is being documented. It is my job, or your job as the coder, to make sure that you are selecting those codes and not just pushing through whatever the provider is selecting. Because when we are with these electronic health records, a lot of times those codes are already selected. It's very tempting, and a lot of people will do this, send those codes on through because the provider doesn't like it when the coder goes and changes the codes. But if there's something that's more specific, it is your duty as a coder to change it to the appropriate code. Whether it elevates the level or whether it downgrades the level, you have to change it. And then you go and tell them. But if they're giving you too hard of a time, is that really where you want to be? Don't you think it would be better for you to be in a place where they understand? Because they're not going to understand at first. You don't expect them to understand at first. But once you start working with them, they will be a lot better for it. And sometimes you have to be the bad guy. You have to be the one to pull them aside and say, okay, let's talk about this. And they're going to say, I don't understand, and this is wrong, or this is stupid. They'll say those things. I've been screamed at many times. Now I just stand there and I'm patient with them. I'm patient because they don't know. And when they don't know, think about this. The average medical coder has a high school diploma or a GED and their certification, right? Unless they've gone to college and gotten their degree. But the vast majority of us have just that. And there's nothing wrong with just having a high school diploma, a GED, and a certification. Nothing wrong with it at all. And many people have lucrative careers with just that, okay? But think about this. You're talking to somebody who's had 10 to 15 years to be a doctor. And this person who has no college background in majority of the cases is telling them that they are wrong. Can you imagine how that would feel? How dare you? How this and that, how that? But that's, again, when you have to work on yourself and your communication skills so that these providers understand that you're actually in their corner. You want these claims to be paid, okay? And you're not looking at maximizing all this stuff. No, because we don't code based on money, because that is unethical, okay? But what we do is we code based on the documentation. And if that provider is doing a lot of things, you want to make sure that everything is being documented, all right? And they may say, well, I don't think that I should do this. I don't think I should do that. Well, think about this. Even if you're undercoding is just as bad as overcoding because it's incorrect. Okay? So you always want to make sure that everything is correct. And the only way to do that is to help them with their documentation. When you see that there's a lot of problems with their documentation, you want to make the time to train them. The training has to be consistent and it has to be where they get used to it. And it can't be, well, we don't have time. Well, we don't have time. But you're going to make time when you have no money coming in, right? So you want to make sure that they're constantly getting that education. And you want them to be okay with getting this education. Education is what I meant earlier. You want them to make sure that they are getting the education that they need to be able to stay informed. When the new guidelines come out, this is another thing you can do to make yourself a better coder. When the new guidelines come out, and during our coding new year, which is October of every single year, is when these new coding ICD-10 CM coding guidelines go into effect. The diagnosis coding the new guidelines go into effect. You want to make sure that you're reading those guidelines. That's why I always make it a big deal on my channel to read the coding guidelines. You would not believe how many people write me hemming and hawing about how it's so much, the print is so little. You can listen to the guidelines online. I've explained it how many times. I'm not going to explain it again. I'm not. because it's in the videos. I'm not going to explain it one more time. So listen to the guidelines, read the coding guidelines. You can make them bigger, you can make the print bigger online, but reading the coding guidelines, that's your base. That's going to be the thing that's going to help you to know about sequencing. That's going to be the thing that you're going to use to defend yourself and your provider's work with the insurance company when they go and they try to deny the claim. And then you can point to a guideline, you can point to a CPT assistant, you can point to a coding clinic, you can point to something in the Merck manual that supports your selection of those codes, right? And so these are all the things that you can be doing, familiarizing yourself with the body, the disease process, and all these things. Familiarizing yourself with the procedures and all the treatment plans that are available for those conditions, for the most common conditions in your facility or your clinic. And then making sure you go over those coding guidelines, staying up to date on those things, and thinking outside of the box. Well, what else can I do, Blue? Well, there's obviously all the videos that are available on YouTube that you can watch. Videos about certain procedures being performed. You can watch other videos about the pathophysiology of those conditions so that you can better understand what is happening. That makes all the difference in the world. There is a huge difference between somebody that's going through and just looking up codes versus a person that understands what is actually happening, so they know they're not going to pick up this code, they're not going to pick up that code because these are symptoms of this. The person that's been reading the coding guidelines is going to say, okay, well, I know according to the guidelines, I'm not going to pick up these codes, but I'm going to pick up this code instead because that's the way the coding rules go. Again, it's like the person that wants to skip medical terminology because you don't need it. Oh, you can just look up the code. Wrong. If you don't understand medical terminology and you don't understand anatomy and physiology, you're setting yourself up for a bad time, when you're looking up these codes, because it's not just looking up the codes, it's actually understanding and comprehending what you're reading. And that is the best way to be able to do right by your provider and to make sure that they are being paid appropriately, because denied claims cause a ripple effect. There's all kinds of incentives that the provider loses when they have all of these denied claims versus the provider who has the coder, who understands what they're doing and is making sure that all these claims are coming out right and that they have a very low rate of error, right? And, they're the ones that are benefiting from that, okay? And that's the only way you're going to be able to do it. No one will hold you by the hand and say, this is how you got to do it. This is how you got to do it. I'm giving you the tips. It's up to you, little birdie, to fly. It is. And whether you are a student right now, whether you're out there looking for a job right now as a coder, or whether you are a brand new coder and you're like, oh my gosh, it's so much. It is a lot. We have to know what doctors know while never having gone to medical school. That's how much it is. It's a lot. And I'm not going to lie to you. It is a lot. But it is doable. It is possible. It is something that we learn all the time. Again, I'm a 16-year veteran, 16-plus year veteran already, and I'm still learning to this day. But I take the time, and when it all really started kicking off was in 2014 when I had my aha moment, when I realized, when I understood, when I started doing things outside of the box, which was I started reading the New England Journal of Medicine. I found out they have like free online articles, and then I actually subscribed where they would send me the magazine. And so that's what I would read on the weekend, and that's what I would do, so that way I can keep up with, okay, oh, now I get it, because there's nothing better than when you read these articles about surgeries and that kind of thing, and you start listening to those words and you start understanding what they mean, even though some of these words are going to go way over your head. Even when I still read it today, some of those words still go over my head, but some of them, like, you can use context clues and figure it out. But for those ones that I was reading, I was like, oh, okay, well, that means that means that. Well, then I overheard my providers. They were talking about a surgery, like an actual procedure, not a patient. They were not talking about the patient. They were talking about the procedure. But I understood what they were saying because I had read the New England Journal of Medicine. I had exposed my brain to all of these other things that helped me to understand what was happening. It is possible to know what's going on, even though you feel like it's a lot. It is. But think about this. They had 10 to 15 years to be a doctor. And you, as a medical coder, or even as a CDI, 9 months, 12 months, or 18 months, if you're in a decently paced program. For some of you, you get 2 months or 4 months. And those are the ones that are really scrambling. Those are the ones that are really having to try very hard because they got in over their head and it's a lot of information and they weren't expecting it. And now they see. Now it makes sense. And now, that lady from Medical Coding with Blue, I understand what she's saying now. Yeah, you understand. And a lot of you say, oh no, I'll be okay. I can catch on fast. Well, but you can still study. You can still apply yourself. You can still use the independent study to supplement your studies. You can still study 20 hours per week. And some of y'all are not even putting in that. And you know it. You need to put in 20 hours per week. It doesn't matter if you're working a full-time job. Everybody will make time for the things that they want to do. And to reach 20 hours in a week, it's 3.5 hours per day for 5 days. And then it's 2.5 hours on a Saturday or Sunday. And that's it. Literally, that's it. And that you can use to make yourself a better coder too. Okay? Understanding what procedures are involved, understanding the reasons for denial when you are getting denials at the, if the insurance is not paying these claims. You need to look and investigate and talk to the provider and have a serious conversation with them and know that you are working with them. And you need to let them know that y'all are a team. This is not I'm going to chase you with a red pen because you did wrong. I've had providers who come to me and said they're brand new to my facility. Of course, I'm always happy and excited to go and meet them and greet them and find out who they are. What facility do they come from? And so, if I know, okay, this is the type of provider that's coming out of this facility, I know because they had these kind of coders over there. They don't have coders over there, And I had one provider who says, I was talking to him, introducing myself and, giving him the little welcome packet, which was a laminated evaluation and management tool and all kinds of little goodies and just like little helps for the clinic and things. And I was talking to him and introducing and doing all these things. And he's just sitting there just smiling. He goes, you're really nice. And I go, thank you. And I was like, okay, I'll take it. He goes, no. He goes, you don't understand. He goes, the coder or the person who did the coding that I had at my last facility said, I'm not a coder, but you're going to do it this way. And I said, you're going to do it this way? And he said, yeah. And I said, oh, no. No. I said, I do not do that. I do not demand that you do something. But I will say this, though. Every coder is different. And I just ask that you have an open mind when I'm coming to you, because we are teammates. Through and through, we are teammates. I will always back you up. And that's what I do as a coder. No one speaks to my providers without my knowledge. And that's the way it is, because if you have too many people talking to your providers, then that leads to confusion, which is another thing that if you are, investing this time into working with your providers and putting aside your own fears about them and their reaction and, things like that. If you can put that aside, you're in for a really awesome growth. You are in for a awesome experience with them. Okay? But just know that everybody has their days. Any blustering in the beginning is not personal. They're just not used to it. But once they see how committed you are to them and to the mission, once they see that, then they're going to understand the difference. Then they're going to know that you're somebody that cares. Okay? And of course, there's always that 1% chance that they may never understand. But that's okay. You'll have plenty of other people around there that will know that you are well-intentioned. But you need to make sure that you are educated before anything else. Before you can ask them to be educated, or you educate them, you have to be the one to be educated. And how do you do that? Reading, investing that time in. And it's going to take time that's outside of work for you to be doing that. You know, attend conferences. You know, if you have your local chapter and they have the meetings, you can attend those. You can attend the national conferences. You can attend those. Those are great way to get started in investing, learning, okay? Because you meet all kinds of people and you can find all kinds of resources at conferences as well. So that's something that you want to look at. Yes, it's going to take a little bit more money, but for those of you who are so excited about adding credentials, it's just as much to go to a conference as it is to add another credential to your name. But the experiences that you will get for conference will far outweigh you carrying a credential that's duplicated on your name. If it's duplicated, if it's already covered in the first credential that you got. I'm just saying. And there's a lot that can be learned at these conferences. A lot. So with that said, do that. Be proactive. Don't look at the money, because the money will be there. But you have to make sure that you're doing right first. If you are concentrating on that, then you don't have to worry about the money, because the money will be there. And what's that saying that says, if you want to buy something without looking at the tag, work without looking at the clock, right? If you want to buy something without looking at the price of it, work without looking at the clock. It is the same idea as the coding. When the coding is correct, the money will follow. The money will follow, and you won't have to worry about that. But don't do things that are just like, oh, we're concentrated on money, because that's unethical. You can't do that. I'm just saying. So with that said, I'm going to wrap this one up. Best of luck to you out there, guys, and I will see y'all next time. If this video helped you, please like, subscribe, and share, and I'll see y'all again. Bye.